So I just want to talk through the different types of HRT that might be on offer, so that when you come for your appointment, you know what it is you would like. So HRT can be divided into different types. I'm going to start with the type which is less talked about, which is vaginal HRT. So that is a very small dose of vaginal estrogen, which gets delivered directly where it's needed for vaginal symptoms. It's very safe because it's a tiny dose and it can be used by more or less everyone. Really, the only people who it's not safe for are probably those who've had breast cancer quite recently, or who are still being treated for it. The estrogen can be delivered either in the form of a tablet, which looks like this little white tablet here. This is the applicator. This goes inside the vagina, and then you press this to release the tablet. It sticks to the vaginal wall and does its job. You can also get these, an applicator like this, which delivers a cream or a gel directly into the vagina. Again, very low dose, much lower than the HRT gel that we think about that gets rubbed into the skin. Very safe, very effective for vaginal symptoms. And then the other type of vaginal HRT that I particularly like is this, which is called an est ring. This is a silicone ring that's very flexible, that contains estrogen that gets delivered a little bit at a time directly into the vagina. Lasts for 3 months. You can take it out and put it in yourself. It doesn't usually interfere with sex, but obviously because you can take it out and put it in, if it does, you can just take it out and put it back again. So that can be very, very useful. So that's vaginal HRT. And you can use that as well as the type of HRT we more commonly think of, which I'm going to call systemic. What that means medically is it goes into your bloodstream, so it gets to every bit of you. So systemic HRT. Most women need 2 types of hormone for this. They need both estrogen and progesterone. If you don't have a womb, if you've had a hysterectomy, you may well only need the estrogen. But I'm going to talk about both types of hormone. The other hormone you probably will have heard of is testosterone. I'm not going to talk about that in this video, actually. So estrogen and progesterone can be taken as a tablet, and there are calendar packs of tablets which you can take every day. Tells you what to take on each day. For women who are still having periods, we tend to have a cycle pack where you're taking the estrogen every day and the progesterone just for half the month, so that you then have a bleed. If you're older and you've stopped having periods, you'd probably take both hormones every day, and that would stop you getting periods back. So that's a simple way to take HRT. We often nowadays, though, suggest that women take the estrogen component of HRT anyway through the skin, transdermally we call it. And this is because you need less hormone to get the same effect. So it can be safer for some women. There are some women who may have side effects from taking the oral tablets, or maybe at slightly increased risk of having a blood clot. And those are women who perhaps are overweight, or may have a history of blood clots or migraine headaches, or maybe older. Now, and there are different ways you can use the estrogen through the skin. I'm going to start by talking about the patch. This is one type of patch. There are different types. The silver is the backing, and the opaque white is the patch itself. I'll take that off so you can see. It looks like this. It's sticky. You take the whole backing off, stick it on the skin, usually below the waist, on clean, dry skin. Hold it down for a moment or two so that it sticks. And then it doesn't usually come off. And you change those twice a week. Those patches vary in their constituency. You can either take just the estrogen that way, or you can take a combination of estrogen and progesterone. And if you do that, the latter, then you don't have to take anything else. So that's your HRT completely in the patch. Again, it can be taken either continuously, so both hormones all the time, or cyclically. So 2 weeks of the month, you'll be using patches just with estrogen. 2 weeks of the month, you'll be using the combination of estrogen and progesterone. So that's a great and simple way to do it. The downside of that way is that you can't really vary the dose, and that the progesterone in the patch is slightly less like our own natural progesterone than in the other form of progesterone that we sometimes suggest. So you could just use the estrogen patch and then take your progesterone as a tablet. These are the tablets that we often suggest for women for the progesterone. So this is a progesterone which is micronized progesterone, which is very similar, if not bioidentical, to our own natural progesterone hormone. So a lot of women like the idea of taking these. These cannot be given through the skin. It can only be taken as a tablet, and either again continuously or for part of the month. You can use these alongside either a patch or a gel. This is estrogen in a gel form, so this is great. It's a pump action. 1 pump down is 1 dose. Again, rubbed this time onto clean, dry skin below the waist or the upper arms, and left to dry before you get dressed. The dose can be varied of this, so that's why a lot of women like this, because you can up the dose if you need to. You can also get it in the form of little sachets. This is similar. It's again estrogen in a gel form. You have to use individual sachets, but it is more concentrated, so it's less volume of gel to put on. And this can be taken again with the micronized progesterone. The other way, which I really like for getting your progesterone, is in a coil. This is, it's not this color, but this is your womb, and here is a Mirena coil sitting inside. This little sleeve you can see here has got progesterone hormone in it, and this gets gradually released into the lining of the womb and stops it from building up. This can be used for 5 years and has the added advantage of being contraception. So if you're starting your HRT in the perimenopause, you then don't need to think about contraception as well. It also is fantastic because it stops you having periods, which in the perimenopause, there isn't any other form of HRT that will do that. So if you're having nasty, heavy periods, this can be really good. Obviously, it does have to be inserted into the womb, but that isn't usually a problem for most women, and we can do that in the surgery. So that is all the different types of HRT in a nutshell, and you can tell us which you would prefer.